Hi, I'm CJ Ryan. I'm doing my thesis under the Health and Human Values minor with Dr. Lamoureux, and I'm looking at socioeconomic factors that contribute to adverse birth outcomes in the homeless population. Right, so it's well documented that homeless women have higher rates of birth defects, fetal death, and low birth weight in their newborns, which is something that has long-term health impacts for both the mother and child. And so I want to look at the underlying socioeconomic factors in this population specifically that researchers believe are contributing to this problem. And then where I come in is looking at sort of what interventions have been effective in the past and how we can bridge that to make a more effective model for women in the future. So a lot of research understands that there is this link between health of the mother and health of the fetus, right? Like understanding that these are intrinsically connected. So thus, my intervention is going to target maternal health and getting access to health care and shelter for homeless women. So understanding that, we need to understand the idea of competing needs, which is that when women are looking for housing or a place to sleep at night, they're not necessarily worried about going to the doctor's visit when something is wrong or may not even have the access to do so. As well, homeless women have 10 times higher mortality rates than the general population, higher rates of victimization, abuse, poor mental health, and less likely to have healthcare access. So we understand that this is a very unique problem in the healthcare of women, and that fundamentally impacts the health of their children. And we can see that in the graphic on the screen as well, how the cycle of poverty contributes to this. So I propose that we get women into shelters when they're pregnant to sort of alleviate these burdens, these socioeconomic burdens, and fundamentally help the health of the mother and therefore the child as well, and get these women resources and access to shelters and healthcare.